everyone. I'm in the ambulance after receiving my third call. So I'm really hoping that it's third time lucky, but I'm sort of not getting my hopes up after having 2 false alarms, kind of preparing that this one's going to be a false alarm too, so maybe I'll be pleasantly surprised if it isn't. We're about a quarter of the way there at the minute, so yeah, just fingers crossed that the things are on my side and the lungs are for me. On February 17th, 2015 at 7 AM, I received my third and final call for lungs. I was taken to hospital by ambulance and arrived by 12 PM. It took until 3 PM to have all the pre-op tests and be confirmed as well enough for transplant. I took a shower with antiseptic and put on my gown. It all felt very real then, although we still didn't know if the donor lungs were okay. We were then taken down to theatre recovery to sit and wait with everyone else for the life-changing moment that the lungs were usable. At 7 PM that call came and I was wheeled into the anaesthetic room where I said goodbye and I love you to my mum before being put to sleep. The transplant took 7 hours until 2 o'clock in the morning. I awoke from the sedation at 10 AM in intensive care with the ventilator still in. My parents were called to come and see me, and by midday they took the ventilator out and I was allowed to have a cup of tea and a nice lolly. I was transferred to the transplant ward the following day to begin my recovery. The physios came to see me straight away and wasted no time in getting me on my feet by marching on the spot and punching with my arms.
Yeah, good. So let's do 20 more. So
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
good. And then a few little steps back so you're out the chair. Good. And then can you punch my hand? Hard as you can. Go on.
I hope
Go on,
she's
and
enjoying
again.
this.
Go on. Really go for it. Go on. Punch a physio. Yes. Good. Yes. Go on. 20 more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Go for it. 13, 14, 15, 16, 17, 18, 19, 20. Yes.
I'm not getting in the ring with you.
I had my main incision scar as well as 4 chest drains, a catheter and a neckline for intravenous use. I was given an epidural in my back to stop me feeling any pain to enable me to get on with physio without any pain. 7 days post-transplant I developed surgical emphysema, a side effect from a big operation like a transplant, where the surface of the new lungs had slight abrasions on it from the retrieval surgery, and so air was escaping from these tiny abrasion holes into my body, causing me to inflate like a balloon. Nothing can be done to treat it except time, as eventually the body reabsorbs the escaped air and you return to normal. Just as I was starting to look more normal, 10 days post-transplant I awoke with a soaring temperature. As the day progressed, not only did my temperature increase, but my breathing became affected. It was clear I had a nasty infection causing these symptoms. By the evening, after having my oxygen increased to support my breathing throughout the day, it all became too much for me and I was transferred onto a CPAP machine, which forces oxygen into your lungs under high pressure, helping you to breathe. I was transferred from the transplant ward back into intensive care, where after the longest and hardest 10 hours on CPAP, I was finally reventilated and sedated to give my body a rest, while they filled me with antibiotics to kill the infection of pneumonia, septicemia and Pseudomonas raging havoc in my body. I was in a medically induced coma for 2 weeks and I almost died twice, but the incredible expertise of the transplant team and intensive care meant I survived and I was able to be woken from the coma and breathe with just nasal cannula as oxygen support. Due to being in a coma for 2 weeks, my muscles had diminished, so I immediately started physio to build and regain strength. I started by sitting in my chair for a few hours to using bicycle pedals and eventually learnt to walk again by myself. At this point, I was deemed well enough to go back to the transplant ward and leave intensive care. It was a huge relief to leave IT intensive care and I settled back into the transplant ward with the McDonald's. I started doing more physio, like walking up and down the corridor. It was exhausting. I felt like Bambi with concrete blocks on my feet. Unfortunately, things weren't as good as they seemed, and after 2 days back on the transplant ward, I began to feel horrendously ill again. I couldn't even speak. I was diagnosed with acidosis, a buildup of toxins in my blood caused by kidney failure. So back to intensive care I went to receive dialysis to stop my kidneys failing. I had to have a vascular catheter fitted and tunnelled under my skin into my jugular. After 2 weeks of continued dialysis treatment, my kidneys regained an acceptable amount of functioning for me to return to the transplant ward to recover fully. Here is a photo of my last day in intensive care with my parents and my first day back on the ward after my first shower and wearing my own clothes. The rest of my recovery was slow but steady. My room became covered in cards and I even had a big Olaf balloon. With lots more physio, I learnt to build up core strength and walk up and down a flight of stairs.
Nice and tall. Set the head up. Lovely. Feel those leg muscles working.
Holly, her first walk down the stairs since surgery. I'm videoing her going down because she whizzed up so fast we missed her.
My scars healed nicely within the weeks I was in hospital, and now, 7 months on, it is a faint white line. On April 16th, 9 weeks since my transplant, I was finally allowed to begin my new life at home.
Still in the bowl.
Yeah, you ready?
Moving.
Let's move. Oh! I did it! Yeah! First glass of fizz to celebrate
There you go.
Cheers!
Cheers.